In your one of your budget testimony documents, you noted that the wages for individuals who are incarcerated, who are working within the correctional facilities, has increased by 20% across the board. Can you help quantify what does that actual number look like per hour?
Yes, it increased to the lowest end is 23 cents an hour to the highest end of 50 cents an hour. But our specialty positions such as barbering, community works program, our training academy, our folks who work at our training academy get 61 cents an hour. Our general labor pool increased to 86 cents per day, and our medical allowance is 60 cents per day.
Per day or per hour? At the last two, you said
The
per
last
day.
two are per day.
Per day? Okay.
Yes.
Versus per hour. Okay, gotcha. So then I wanted to switch gears a little bit and talk about the prison medical copay being $5. I know that there are some exceptions around paying that copay, around mental health treatment, laboratory tests, parental care, and medical treatments for chronic illnesses. Outside of those, what are people typically using that copay for outside of the exceptions that are there?
Yeah, I understand that this is a discussion that's come up in the past, and you know, we're certainly open to discussing it further. But as you mentioned, our goal is that the copay applies to just general sick inmates who have some general illness, non-emergent issues. Folks who have chronic conditions, they get seen without the copay, which is really what our system is designed for. We want folks who have those chronic conditions and have multiple appointments to be able to be seen. I will tell you that we did eliminate the copay during COVID, and it absolutely clogged our system. We went from a 25% sick call rate to a 42% rate. It almost doubled. Our providers simply could not keep up with the demand because we had folks literally putting in sick call slips every day, maybe just to take a walk up to medical, maybe to see someone, their favorite medical professional, not sure. We had folks submitting sick call slips every week. At one of our female facilities, they had a 60% increase, 67%, I'm sorry, of their females put in sick call slips weekly. Our providers simply could not handle the demand. And so the folks on that list who don't require a copay, particularly ones that have chronic conditions, we couldn't keep up with the demand to see those individuals, and they're the most vulnerable. And so we feel we really have a good balance with who should and shouldn't pay a copay. Again, we're open to discussions on this issue because I know there's folks on both sides of the fence with whether it should or shouldn't be eliminated, but because we have experience with removing it, they don't have to, for example, flu-like symptoms and COVID symptoms, they don't have to pay a copay. We want people to report those. So I think intake procedures, I mean, there's a whole list of where they don't have to pay. So we really feel like we've found a happy medium with this issue.
Yeah, and I would love to continue to have those conversations with you and your staff. I think that this is an issue where, yes, I'm sure that you are running into sort of barriers in terms of people overloading the system.
Right.
But also I think of sort of the folks who are not needing, have chronic illness. We can also look at it in the vision of preventative care, so that we are taking care of them on the front end so that, you know, a year, 2 years down the line, they don't end up having to be there more often because they have chronic illnesses. So trying to figure out how we can address it on the front end. And so I'm not necessarily advocating for taking away the copay, but I want to just continue to have those open dialogues and conversations with you and your staff about what the best solution is. Because like, as you mentioned, 23 cents for the lowest pay. I mean, I'm not sure how many hours somebody has to work in order to make $5 on a 23 cents per hour. But it seems like they would have to work maybe 4 or 5 days to even make that amount of money. So it's a lot to ask somebody to work that much to have $5 to pay for their copay. So looking forward to continue to having those conversations with you and your team. Thank you, Mr. Chairman.